Good day, everyone. Today we're going to talk about a critical health issue, stroke. It's one of the leading causes of disability and death worldwide, but with proper awareness, early recognition, and prevention, we can save lives and improve outcomes. Let's dive into the key aspects of stroke, its causes, symptoms, consequences, diagnosis, treatment, prevention, its impact on families and society, and the latest advancements in treatment. Let's start by understanding what causes a stroke. Essentially, a stroke happens when blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. Without these, brain cells begin to die within minutes. There are two main types of stroke, ischemic and hemorrhagic. An ischemic stroke, the most common type, is caused by a blockage in a blood vessel supplying the brain. This blockage is usually a blood clot or a buildup of fatty deposits known as plaques. On the other hand, a hemorrhagic stroke occurs when a blood vessel in the brain bursts, leading to bleeding in or around the brain. Now, let's look at the risk factors. High blood pressure is the leading cause of stroke because it puts extra strain on blood vessels, making them more likely to burst or become blocked. Other significant risk factors include diabetes, smoking, obesity, and high cholesterol. Certain lifestyle choices, such as lack of exercise and unhealthy diets, can also increase the risk of stroke. A special warning sign to note is a transient ischemic attack, or TIA, often called a mini-stroke. TIAs occur when there's a temporary blockage in blood flow to the brain, causing stroke-like symptoms that go away within minutes or hours. Although they don't cause permanent damage, they're a critical warning sign that a major stroke may occur in the future. Understanding the causes of stroke is the first step toward prevention and early intervention. By identifying risk factors such as high blood pressure, smoking, and unhealthy lifestyle choices, and recognizing warning signs like transient ischemic attacks, we can take proactive measures to protect ourselves and our loved ones from the devastating effects of stroke. Now that we understand what causes a stroke, let's discuss how to recognize one. Stroke symptoms often appear suddenly, and recognizing them early can be the difference between life and death or recovery and disability. The most common symptoms of a stroke can be remembered using the acronym FAST. F stands for face drooping. One side of the face may droop or feel numb. A stands for arm weakness. One arm may feel weak or numb, and the person may be unable to raise both arms equally. Stands for speech difficulty. The person may have trouble speaking or understanding others. T stands for time to call emergency services. If you notice these symptoms, act immediately. In addition to FAST signs, other stroke symptoms include sudden trouble seeing in one or both eyes, dizziness or loss of balance, and a severe headache with no known cause. These symptoms can vary depending on the part of the brain affected by the stroke. Recognizing these symptoms early is critical because time is of the essence. Brain cells begin to die within minutes of a stroke, and the sooner treatment begins, the better the chances of recovery. This is why it's essential to call emergency services immediately if you or someone around you shows any stroke symptoms. It's also important to note that not all strokes have obvious symptoms. Silent strokes occur without noticeable symptoms, but still cause damage to the brain. Over time, these can lead to memory problems or difficulty concentrating. Regular health checkups can help detect silent strokes early. Recognizing the symptoms of stroke quickly can save lives and prevent long-term complications. By staying alert to signs such as face drooping, arm weakness, speech difficulties, and acting fast when these occur, we can ensure that those affected receive the urgent care they need. Awareness is a powerful tool in the fight against stroke. After understanding the causes and symptoms of a stroke, let's now discuss the consequences. A stroke's impact depends on its severity and the area of the brain affected. While some people recover completely, others may face long-term challenges. Physically, stroke survivors may experience paralysis or weakness on one side of the body, known as hemiparesis. This can make simple tasks like walking or holding objects extremely difficult. They may also lose control of their facial muscles, impacting their ability to smile or speak clearly. Cognitively, strokes can impair memory, concentration, and problem-solving abilities. Survivors may find it hard to remember recent events or manage daily tasks. Emotionally, many experience depression, anxiety, or mood swings due to changes in their brain or challenges in adapting to a new lifestyle. Another common consequence is aphasia, a condition affecting speech and language skills. People with aphasia may struggle to find the right words, understand others, or express themselves. Speech therapy is often necessary to help regain communication abilities. Severe strokes can result in permanent disabilities, such as the inability to walk, eat, or perform daily activities without assistance. These challenges often require long-term care and rehabilitation, significantly affecting the individual's independence and quality of life. The consequences of a stroke extend beyond the individual. Families may face financial strain due to medical bills and caregiving responsibilities. Additionally, society bears the economic burden through lost productivity and increased healthcare costs. The impact of stroke goes far beyond the physical, touching every aspect of a survivor's life and extending to their families and communities. By understanding the challenges stroke survivors face, whether physical, cognitive, or emotional, we can better support them in their journey to recovery. With empathy and a commitment to providing the right care, we can help rebuild lives and foster resilience in the face of adversity. Having discussed the causes, symptoms, and consequences of a stroke, it's time to explore how strokes are diagnosed and treated. Prompt diagnosis and effective treatment are essential to minimizing brain damage and improving recovery outcomes. Diagnosing a stroke typically involves imaging tests such as a CT scan or MRI. These tests help doctors identify whether the stroke is ischemic, caused by a blood clot, or hemorrhagic, caused by bleeding in the brain. Additional tests, like blood tests and electrocardiograms, are often performed to determine the underlying causes and guide treatment. The treatment for ischemic stroke focuses on restoring blood flow to the brain. The most common approach is administering clot-busting drugs, such as tissue plasminogen activator, PPA, within a few hours of symptom onset. In some cases, doctors may perform a mechanical thrombectomy, a procedure to physically remove the clot from the blood vessel. In contrast, the treatment of hemorrhagic stroke involves controlling bleeding and reducing pressure in the brain. This may include surgery to repair damaged blood vessels or remove pooled blood. Medications are also used to lower blood pressure and prevent further bleeding. Rehabilitation is a crucial part of stroke treatment. It helps survivors regain physical and cognitive abilities. This includes physical therapy to improve mobility, speech therapy for communication challenges, and occupational therapy to relearn everyday tasks. Emotional support and counseling are also essential for recovery. Time is critical in stroke treatment. The faster treatment begins, the better the chances of limiting brain damage and improving recovery. This is why it's important to seek medical attention immediately when stroke symptoms appear. Timely and accurate diagnosis paired with the right treatment can make all the difference for stroke patients. Whether through rapid medical interventions like TPA or advanced procedures such as thrombectomy, the goal is to preserve brain function and improve recovery outcomes. Acting quickly and ensuring access to effective treatments are essential steps in reducing the devastating impact of stroke. Prevention is always better than cure, and this is especially true for strokes. While some risk factors, such as age or family history, cannot be changed, many strokes can be prevented by managing controllable risks and adopting a healthy lifestyle. A healthy diet plays a critical role in stroke prevention. Focus on consuming fruits, vegetables, whole grains, and lean proteins while limiting salt, sugar, and saturated fats. These dietary choices help control blood pressure, cholesterol levels, and body weight, which are major stroke risk factors. Physical activity is another cornerstone of prevention. Engaging in at least 30 minutes of moderate exercise, like walking, swimming, or cycling, most days of the week can improve cardiovascular health, lower blood pressure, and reduce the likelihood of diabetes, all of which lower stroke risk. Smoking and excessive alcohol consumption are significant contributors to stroke risk. Smoking damages blood vessels and increases blood pressure, while excessive alcohol intake can lead to irregular heart rhythms and high cholesterol. Quitting smoking and drinking in moderation can dramatically reduce your stroke risk. Managing chronic conditions such as high blood pressure, diabetes, and high cholesterol is vital for stroke prevention. Regular checkups, medications if necessary, and adherence to a treatment plan can help keep these conditions under control and significantly lower stroke risk. Being aware of warning signs such as transient ischemic attacks, TIAs, is another crucial aspect of prevention. TIAs, or mini-stroke, are often precursors to a major stroke. If you experience any stroke-like symptoms, even temporarily, seek immediate medical attention. Finally, public education and awareness campaigns play a key role in prevention. Learning about stroke risk factors and adopting healthy habits not only benefits individuals, but also reduces the overall burden on healthcare systems and society. Preventing stroke begins with taking control of your health. By adopting a balanced diet, staying active, avoiding harmful habits, and managing chronic conditions, you can significantly reduce your risk. Awareness and proactive measures not only protect individuals, but also create healthier families and communities, paving the way for a world with fewer strokes. Stroke doesn't just affect the individual, it profoundly impacts families and society as a whole. The physical, emotional, and financial burdens of stroke are long-lasting and far-reaching, requiring collective awareness and support. For families, the emotional toll can be overwhelming. Watching a loved one struggle with physical disabilities or cognitive decline is heartbreaking. Caregivers often face stress, anxiety, and even depression as they adapt to their new roles and responsibilities. The financial burden of stroke can also be significant. Medical bills, rehabilitation costs, and long-term care expenses add up quickly. Additionally, family members may need to leave their jobs or reduce work hours to become full-time caregivers, further straining household income. Stroke survivors often face social isolation and stigma, Physical disabilities or speech difficulties can make social interactions challenging, leading to feelings of loneliness and exclusion. Society must work to create inclusive environments that support their reintegration. On a broader scale, stroke places a substantial economic burden on society. Healthcare systems bear the costs of emergency care, surgeries, rehabilitation, and long-term support. Additionally, stroke disabilities lead to lost productivity, affecting the workforce and economic output. Community support is vital in addressing these challenges. Support groups, educational programs, and accessible rehabilitation services can help both survivors and their families cope with the aftermath of stroke. Raising awareness and advocating for policies that prioritize stroke care are also essential. The effects of stroke ripple through families and society, creating challenges that require collective effort and understanding. By supporting stroke survivors with compassion and providing resources for families, we can alleviate the burdens they face. Together, through awareness, advocacy, and action, we can build a more inclusive and supportive environment for everyone affected by stroke. In recent years, advancements in medical science have revolutionized the treatment of stroke. These innovations not only improve survival rates, but also enhance the quality of life for stroke survivors. Let's explore some of the most promising developments. One groundbreaking advancement is prevent from large arteries in the brain, significantly improving outcomes for patients with ischemic strokes when performed within hours of symptom onset. This procedure can restore blood clots from large arteries in the brain, significantly improving post-occupants with comfort and safety by symptom tracking persisted in hearing. Another critical development is the widespread use of tissue plasminogen activator, or TPA. This clot-busting drug is administered intravenously and works by dissolving blood clots. It is most effective when given within 3 to 4.5 hours of the first symptoms, making early diagnosis essential. Researchers are exploring neuroprotective agents, which are drugs designed to protect brain cells from damage during a stroke. While still in experimental stages, these drugs hold promise for minimizing long-term disabilities and enhancing recovery outcomes. Artificial intelligence, AI, is becoming a game-changer in stroke care. AI tools can analyze brain scans quickly and accurately, helping doctors diagnose the type of stroke and recommend the best treatment plan within minutes. This speeds up decision-making, which is critical in stroke management. Stem cell therapy is another promising field of research. Scientists are investigating how stem cells can be used to repair brain tissue damaged by stroke. Although this treatment is still experimental, early results suggest it could help regenerate neural pathways and restore lost functions. Telestroke services, which use telemedicine technology, have expanded access to stroke specialists. In rural or underserved areas, patients can receive expert care through virtual consultations, ensuring timely treatment even in remote locations. Advancements in stroke treatment are transforming the way we manage this life-threatening condition. From innovative clot retrieval devices and AI-driven diagnostics to experimental therapies like neuroprotective drugs and stem cells, these breakthroughs are paving the way for improved recovery and reduced long-term disabilities. The commitment to research and innovation continues to offer hope for stroke survivors and their families, bringing us closer to a future where the impact of stroke is minimized. Throughout our discussion, we've explored the critical aspects of stroke, its causes, symptoms, consequences, diagnosis, treatment, prevention, societal impact, and medical advancements. Each piece of this puzzle is crucial in understanding and combating one of the leading health challenges of our time. Stroke is a condition that affects not only individuals but entire families and communities. Yet, with increased awareness and proactive steps, many strokes can be prevented, treated effectively, or their impact minimized. Education, quick action, and support systems are our strongest tools in this fight. Looking ahead, advancements in medical research and technology promise a brighter future for stroke care, from AI-powered diagnostics to innovative treatments like stem cell therapy. The possibilities for recovery and prevention are expanding. Each breakthrough brings hope to millions of lives worldwide. As we conclude, let us remember that each of us has a role to play, whether it's spreading awareness, supporting those affected, or advocating for better healthcare policies. Together we can make a difference. Stroke is a challenge we can overcome with unity, determination, and compassion. Thank you for joining this essential conversation about stroke. Together, we can make a difference by spreading awareness, inspiring change, and taking action towards a healthier, stroke-free world. If you found this discussion valuable, don't forget to like, subscribe, and follow our channel for more content on health and wellness. Let's stay connected and work towards a brighter future together.